The government of Kenya has scaled up its approach to issues of maternal health, primarily because it is one of the areas where we didn't do very well on the MDGs. We, in some ways, regressed in spite of a lot of efforts. We began to work with partners across the board. We began to look beyond the obvious, beyond resource allocation, beyond building hospitals, beyond training health personnel, which we are doing in any case and we were doing before, into what else is out there that works. And that's why when we heard that World Economic Forum is undertaking this program, we were excited by it as an avenue for reaching out to the world to begin to identify best practices from other countries, to begin to see which of those we can harness to help us regenerate momentum on this agenda. One of the key benefits that I see about involving the private sector in this Leapfrogging project, and indeed in accelerating our work in improving maternal health, is twofold. The first is basically extending the government's reach in terms of harnessing innovations that come more naturally and more easily through the private sector. The second is the private sector does bring business models that help to improve efficiencies, that help us to focus much more sharply on results. So I see a benefit for us as a country in terms of improving service delivery, improving results. And finally, working with the private sector in the health sector through this program, I expect that we're going to create a model for public sector collaboration to deal with critical development bottlenecks that are going to extend beyond the health sector as we go forward.
My name is Siddharth Chatterjee and I'm the representative of the United Nations Population Fund in Kenya. So the 6-county initiative came about after we realized that Kenya stood amongst the 10 most dangerous places in the world for a woman to give birth. And 15 counties of Kenya contribute to 98.7% of maternal deaths. It exemplifies 3 major issues. Number 1 is the inequity. Number 2, a broken health system. Number 3, a level of lack of devolution, and therefore that aspect of counties which were traditionally marginalized got even increasingly marginalized. When we looked at 6 of these counties out of the 15, they themselves contributed to 50% of the maternal deaths. We realized that in the rest of the 9 counties of the 15, there was a certain amount of work taking place, but these 6, particularly the ones that I named, Mandera, Wajir, Marsabit, Lamu, Migori, and Isiolo, were left out. They were like an outlier in a statistical bell curve of poor maternal health. And that's what prompted UNFPA to take the lead and address the issue collectively with the government of Kenya, with the private sector, with our civil society partners, and launched a $15 million program last year.
My name is Dr. Ahmed Sheikh Mohammed, the Mandera County Executive for Health. We decided to join the Leapfrogging program for innovative purposes, because we wanted to bring many actors together. Because health is not about the county government of Mandera, it's not the national government, it's about the partnership, it's about involvement of many actors in supporting the health initiative. It is also about innovation. What else different can we be able to do differently from what is being practiced today? The impact of collaborating with UNFPA in Mandera is huge in terms of access, utilization, and management of the health facilities.